Uh, Thank you once again. I'm very grateful to Pelium for inviting me for their nursing sessions. So today we will see about the basic nursing issues. Can everyone see my screen?
Yes, ma'am, we can see your screen.
Okay. So as nurses, we deal with many of the things, right? Whether patients are in the hospital or patients are at home. I mean, maybe they may be our neighbors, maybe our relatives, everyone. And we face many of the problems, and uh, persons require much of the attention, especially when they are sick. In palliative care setting, you must have come across many of the persons who really need very good care. If it is not given properly, then they can land up into problem. So we are going to see some of the problems here. Now, there are plenty of the problems, okay, but we will deal mainly about the hygienic needs of the patient, nutritional needs, elimination needs mainly, okay, and some of the needs related to exercise. Many other needs will also be there, but maybe in successive sessions you will come across in this program. Fine, so let us review our knowledge in skin care. It may be named by many of these. You may tell it as sponge bath, bed bath, bathroom bath. Patient is able to go to bathroom, then it is known as bathroom bath. Many times patient, we give care partially only, right? Then partial bath. If back care is required, then back care, right? So the purpose of all this care are generally in common. If we see, then basic thing is to clean the skin and refresh the patient, right? It also helps in stimulating circulation by the movements, long strokes which we give to patients, and also it will clean the skin pores, so it will of course improve elimination through skin. It will also help in maintaining body temperature. Skin is the largest organ of our body, so to take good care of it will help in many ways. It will also help in relieving fatigue. Patients, when they are in bed for long periods of time, though they are not doing anything, they will feel fatigued, tired, right? So this procedure will help them to relieve that. Plus, we will be able to improve our IPR with them. We can find out many other problems also related to their illness, or maybe some of the social conditions, and many more. You must have learned about the assessment of patient and holistic approach in that. So we can talk many things to patient during this time. And if we are taking help of the patient's relative, then that also will be beneficial, because we have opportunity to teach them, because ultimately patients' relatives will be taking care for long run. Always nurses will not be available for their care, maybe in the hospital or in the home care setting. And our main issue is related to patients who are requiring palliative care. Okay, so in long run, ultimately the relatives and friends will be taking care of them. So it is very helpful in that sense also. Plus, it will be very helpful to give them good sleep, okay, and a general well-being also will improve with this procedure. Right. So what to remember particularly? As we do the steps, we will have many things to remember. Say starting from the temperature of the water, right? How to check temperature in hospital setting? You may be using solution thermometer, or at home setting you can use the back of your hand to check the temperature, or maybe elbow to check the temperature. So it should be comfortably warm for patient, so that he doesn't get any chills because of cold water. And of course, the explanation of procedure to have good cooperative patient is always required. So that should be done. Uh, we should see to it that we don't break our own back, right? So you have to keep the patient near your body. And of course, when we are giving care, we do remember that we go from clean to dirty part, right? And of course, the far parts are cleaned first and then the near parts, right? So all the remembering all the scientific principles is also very important. Removing of soap completely from the body is very, very important. Otherwise, it will give drying effect. Okay, and not to forget the creases of the skin, folds of the skin, and while we are cleaning. And after good cleaning comes the drying part. So pet drying is always good rather than rubbing, because many times fragile skin can come off and can lead to even bed sore. So always we need to remember this. Uh, Hands and feet will again require meticulous care, because we have to clean between the digits, and always observation of the skin is important in the procedure. And in a palliative care setting, after cleaning comes the moisturizing of the skin. So generally we learned that we always use talcum powder, right? But in palliative care setting, we don't use talcum powder. That should be remembered. Instead, skin is tried to keep supple and soft, so that it doesn't chip off. Okay, and the material which is available at home is generally advised, because most of our patients many times are very poor, right? So rather than uh, telling them, asking them to get fancy things, we can just ask them to use our coconut oil or Vaseline. They are good enough to keep the skin moisturized. When we are giving them care, uh, we do have to remember that we change their position every 2 hourly. Why so? Because to prevent bed sore, right? And another thing is that whenever we give skin care, at that time, good observation of all these pressure points is required. When we are giving massage, after giving them bath, good bath, so we need to remember these points and uh, see to it that there is no skin changes seen in this part. And I'm hopeful that you remember all these points where we can, bony prominences, where we can, our patient can get bed sore. What about the patients who are in wheelchair? Because many of these palliative care patients will be in wheelchair. Okay, so in wheelchair also, by some movement, you have to change the position. If you place a bed sheet below patient where patient is sitting, then that also can be moved. So every 15 to 20 minutes, it is good to move patients, so that these patients also don't get any kind of bed sore. And on bed sore, you will have another class also where you will learn all things in detail. Gentle massage is very essential, not to rub vigorously or not with too much of pressure. Okay, and of course, when the already bed sore is developed, never to massage on that area. Otherwise, it will cause more tissue damage. And it is also it will also help the positioning, repositioning of the patient during bed bath, that the joints will get passive stretching. Okay? And of course, each joint will require at least 10 times stretching and twice in a day, right? This will help in preventing atrophy of the muscles and contracture of joints. And of course, it will prevent deep vein thrombosis also. Positioning of pillows is also very important when we are giving change in position, right? And always see to it that bony prominences are kept padded with the help of either pillows or soft clothes. Any of the clothes they can use whatever they have at home, uh, because it is very easy to get pillows in hospitals, but so many pillows won't be available at home for just one patient, right? So we should also remember that ultimately we need to protect the prominences from pressure. Okay, so pressure, shear force, and avoidance of moisture. That these three things we need to remember while protecting patients from bed sore. Many nowadays, this type of mattresses are also easy to get even in the community. Many of NGOs also provide them at nominal charges, and they have become cheaper also. These type of mattresses, air mattresses or water mattresses, can also be used at home, right? But many times what happens is that patients are kept directly over that mattress. Okay. Now, mattress would be made up of either rubber material or plastic material. Then direct irritation, it will cause irritation to patient's skin. So patient should never be kept directly over it. Always instruct them to place a bed sheet over this mattress and then place a patient. And of course, identifying of the patients who are at risk is very, very important. So whenever we are giving care to patients, see to it that you identify such patients who are at risk for developing bed sore, especially. And if at all patient gets bed sore, then what to do? So there again, principle of good cleaning, irrigation, and in palliative care, we use normal saline. Okay? Regular dressing of the part is important, and regular inspection, and not to forget the documentation. Right. So whenever we are giving care, documentation is also must. So that will help in whenever there is change of shift, change of the caretaker in the uh, hospital setting, that is very essential. Next comes oral care. So what are the purposes of oral care? Our patients and who all will require oral care, and what we will remember in that we will discuss in this. So to maintain healthy mouth, all the parts of the mouth, right? It may be gums, it may be teeth, maybe oral buccal mucosa, lips, everything, right? So to keep the parts healthy, this is very essential. It will also help in cleaning of the removal of the food particles, plaque, and bacteria which right? It will help in massaging gums and whatnot. So that is very, very important. Whether patient is able to walk or patient is not able to walk or patient is unconscious, right? In any condition, mouth care is must. So generally in palliative care setting, our patients will be either terminally ill or patient will be post-operative. Many times patient will have infections in their mouth. Patient may be receiving tube feeding, patient may be unconscious, or patient is not able to breathe naturally and patient is a mouth breather, right? So in all these situations, they will require meticulous oral care and to teach the patients and relatives that why it is essential becomes our duty. So what are the materials that are used? We know that generally we use different types of toothpaste or tooth powder. Many times sodium bicarbonate paste is also used, neem stick, even H2O2 we use in hospital, right? And the solutions which are used are generally potassium permanganate, hydrogen peroxide or normal saline. In palliative care, normal saline is very, very freely used. So we also need to teach patients how to make normal saline. Okay, so that is that we will see in some other slide. And emollients, which are the emollients that are used to keep the lips in good soft condition, like cream or butter that is very easily available in the house, even Vaseline, liquid paraffin, glycerin, and in some cases olive oil also. So whichever thing is easily available in patient's house can be advised to use it. And what we need to watch out when we are giving care. Okay. So always see that there is no loose tooth when you are giving care. Artificial teeth, right, that also should be removed. If patient may not be having full dentures, so we need to see that only partial denture is there, then we need to remove it and also teach them how to take good care of dentures. Also check whether there are cracked lips, there is coated tongue. If so, then how it is coated, whether there is cord-like patches are there or there are any ulcers, whether patient is having any bleeding from the gum, any specific, you may be saying discoloration of the teeth, then find out what medications patient is receiving, right? Whether patient is having any pain in mouth, he may be having different ulcers, or patient is there is raw area because of the radiation or chemotherapy. What is it, right? So it is always good to have good history of the patient. Find out whether there is any dysphagia or is there any change of taste of the food is there. Patient is having any difficulty in chewing, any kind of anorexia or unpleasant smell patient is feeling or we are getting it. And as I told you, treatment history. In patients, there may be many of the problems. One most common is bad breath, or we name it as halitosis. So there can be causes like dietary also. It can be because of the dry mouth also, or any oral conditions, any infections, or if the patient is having some GI problem, or whether patient is having bowel obstruction and he is vomiting stool, right? So any of the reason why there is halitosis, or if there is any lung infection, whatever. So identifying of the cause is very essential because our care will go accordingly, right? And if we talk about non-pharmacological interventions, then good oral hygiene is one. For bad odor, we also advise them the metronidazole gargles. You may wonder, and some of you might have come across it also. So here, what you are getting the metronidazole pints. So from that, you can take 3 to 4 drops and in a glass of water, you put it. It is very bitter in taste, and then ask patient to gargle. So it works wonders, and the bad breath will go, bad smell will go. You can also use soda bicarb and chlorhexidine mouthwash. Many times patients do feel some irritation, burning effect because of the commercial mouthwash. So when we are prescribing it, always ask whether patient is getting such feelings or not. And of course, the normal saline mouthwash is also good. If the patient is having dentures, then what? So as we take good care of natural teeth, same way patient has to take good care of dentures. If patient himself cannot do, then the relatives should be taught to how to do it, right? And whether patient is having good intake or not, good food intake will also help in they're not just feeling of, removing their hunger, but it will also have some cleansing effect also of mouth, right? And the patient can also have flavored chewing gum or mint sweeteners can be used, so that also is good for removing halitosis. Pharmacological interventions will include use of metronidazole, and if there is infection, settled infection, then maybe the systemic use also. Similarly, metoclopramide also. As per the patient's cause, we need to identify and give the treatment. Many patients will have either decreased secretions or increased secretions, right? So decreased secretions will cause dry mouth, and increased secretions will cause drooling, right? So we need to identify the problem. If the decreased secretions are there, many times the lemon drops and chewing of the pineapple piece will help in activating the salivary glands. Okay, I mean stimulating also, right? So that will help. If there is increased secretions, then we can use atropine drops, right? Eye drops which come. So those 2 to 3 drops can be placed under the tongue. Okay, so that will help decreasing the oral secretions. If there are some white patches which are not going off uh, during our general cleaning, then you need to see, and whenever there is any complaint that patient is not able to or patient doesn't like to eat food, don't forget to open his mouth and check with the torchlight. Okay, because many of the patients who are bedridden will have this oral candidiasis. So you need to give real good or advise good oral care in them. Uh, Good care generally helps in prevention also, and Generally, nystatin suspension is used. Topical application is coming of this drug, so that will help in removal of the oral candidiasis. But on our part, not to forget to check their oral cavity whenever you happen to see the patient, whether in the hospital setting or at home, right? So when you are going home at that time also, always check uh, the oral cavity, whether they are taking good oral care or not. Halitosis we just talked about. Patient may complain of altered taste. If there is a reduction, it is known as hypogeusia. Any distortion, then it is known as dysgeusia, or absence is known as ageusia. So causes may be many. So identify whether the patient is having any xerostomia, or patient is having any treatment, because of that he is feeling bad taste. Many times if the patient is having zinc deficiency, that is very commonly seen in patients with malignant diseases. So if it is there, then multivitamins with zinc supplements can be given orally. And less secretion, many times it is what we can tell patient is to have some ice candy. Sucking will also help them. Any flavored, if they like, just make whatever juice is available at home, turn it into ice cubes, and then they can keep in the uh, mouth, so they will feel comfortable. So maybe orange or lime or whatever. So these are some of the remedies for oral problems. And general health education should always be given to the patients. Ideally, they should brush their teeth twice in a day. And in cancer patients, especially, we need to tell them to use soft toothbrush, or with the help of soft cloth, they can take the oral care, right? And they should always see to it that they gargle enough after cleaning, because toothpaste that is left in mouth can cause dryness. So always tell them to gargle for enough number of times after the care. Uh, Tongue cleaning is again becomes issue when, especially when it is chapped and there are any cracks in it, especially patients with cancer who are receiving chemotherapy or radiation therapy. So clean it gently. You can always use gauze piece that is uh, wrapped around either wooden spatula or from the back of the toothbrush. Otherwise, you can remove the any old toothbrush, patient's toothbrush, and remove the soft bristles which are in front part, and then use it as a stick. And always when we are giving care at that time, we should remember that when you wrap the cloth around the brush, always keep one and in your between your thumb and finger, okay, so that you have control over it. It should not go inside, so that need to be seen. And the threads coming out also should not go in that also, because many of the patients will not be having good gag reflex, so they may land up into problem because of aspiration of this foreign material. So whenever we are giving care, we also always have to be very observant. Dentures always should be removed at night. So when they are going for sleep, ask the relatives to make it sure that they have removed dentures. When the patient is dependent, at that time you need to explain the procedure whenever you are giving any doing any procedure to them. And adequate privacy is also essential. They will not like others to see them in such bad shape, right? One side saliva will be drooling, or the toothpaste is coming out, and all those things they will not like. So put them in good position, and then you make use of napkin around their neck, uh, place the kidney tray or bowl in front of them over the cardiac table, and then if they are uh, taking brush into their hand, then always encourage them, because they will have self satisfaction also that they are able to do it. If you have to do it, then we need to take all the precautions. Okay, and when the patient is unconscious, always see to it that you don't make them gargle, right? Because there are always chances of having it aspirated. And before and after procedure, of course, washing of hands is must, so that we remember. Okay, and they will unconscious patients will not only gargle, but also you have to see to it that you can open their mouth enough so that you can clean it, you can watch it and clean it nicely, right? So you may have to use mouth guard or wooden spatula covered with the gauze piece, and turn the patient's face on one side so that all the drooling will come out. It's saliva and water material, whatever you are using will come out. Right? And then take good care of the lips, of course. Next comes the hair care. This is also very, very important, because when the patient is in the bed for a long time, we very much like to give bed bath. But hair care, most of the nurses, they are many times afraid, and patients also find it very funny. They will say, no, no, we don't want any hair care. And then they have all the matted hair, and there can be lice infestation and many of the other problems, dandruff and everything will be there, right? And then they will start scratching, and additional infections they will have. So it is very essential to keep their hair clean and healthy, right? It will also help in good growth. Many times, of course, we need to take patients' concern also, that what we always saying now, that once the patient becomes bedridden, means you cut off the hair. Of course, it is very easy for us to tell that, but for many, it will be very important, because hair gives beauty, right? So they won't like to cut it off. So always look at the patient point of view also, and that will help in removing itching and infection and all the purposes. I need not tell you each and everything, right? So neatness will also be there, right? So always remember that. So here again, we will explain the procedure, right? Patient will be kept flat, and we also need to find out the condition, whether this condition permits or not, because many times patient may be having breathlessness, and you make the patient flat, that's all. You will not be able to move to second step. So not to do that, and place the pillow under the shoulder so that head will be tilted slightly, trough making, and how the water should go in the bucket and all that. Protect your own clothes also, that should not be forgotten. right? So, and protect the ears, that your water shampoo should not enter, and eyes, of course, uh, that should be remembered. So whether you use shampoo or soap, always remove it nicely with the help of adequate water, and after wash, dry hair thoroughly and gently remove the tangles. And when they are in supine position, I mean, when they are in bed, generally they like to tie their hair loose, and two plaits for female patients will be good, so that they can turn their head from one side to another. And of course, when you complete the procedure, recording whatever abnormality you have found. Further, if you need to give any treatment for lice infestation and all, that should be taken care of. Eye care is very important, right? Because if eyes are dirty, then no one like to look at the patient, and patient will also have discomfort, infections will take place, right? Additional injury it can cause. So to prevent all this, eye care becomes very essential. And many of the times it may tell us the condition of the patient. Also, patient is having other problems of body, that also can be found out. So how to give good care? Again, need to explain the procedure. Comfortable position is must, right? And eyelids and eyelashes are cleaned with wet swabs, okay, so warm water, and wipe the from inner canthus to outer canthus. So that is the principle we need to use. And of course, one swab for one stroke. Always need to remember that. And the documentation part. Again, in the eyelids also, eyelashes also, many of the time there is dandruff. So we need to observe the condition also. If they have any sty or any other infection, so need to be look for it, observe it. Many times patients are unconscious and they are not able to close their eyelids completely, right? So in them, there are always chances that eyes will turn very dry. So in them, you need to use, moisturize them with the help of refresh eye drops. And if there is any infection, then as per the doctor, need to apply eye ointment or eye drops. So you have to see to it. Then care of ear and nose also are important. So we should not just forget them, right? So many times nostrils become, there are secretions, dried secretions, especially when there is NG feeding tube in place, right? So at that time, we need to clean nostrils properly. Either you can use a wet cloth or applicator or swab stick you can use, and clean both this ear and nose. And not to forget the back part of the uh, ears when we are giving hair care also, and when we are giving them bed bath also, right? Because that creases also many times have dry skin and secretions. Many times it happens that all the drools that have come out of the mouth will settle here, and they will give bad smell also, bad look also, and of course the growth of the microorganisms. So we need to see that, and check once in a while about the collection of the wax in the ear, because that can also cause hearing problem. We know, right? When we are healthy, we can take care of ourselves, but when the person goes into bed, then self-care becomes very difficult. So the person who is giving care has to think of his body as if he is taking care of his own body. Nail care, again very important, because when there is dry skin, and then the patients will try to start scratching, okay, and skin will be broken and infection will take place. How many times patients' nails are become very dry and thick, right? So how to tackle them is the one good key is that you place in the warm water in the basin, and you can add few drops of shampoo, so that will soften the nails, and the dirt also will come off. Is and then you try to cut it, then it will be very easily cut. And of course, after cutting, uh, nails also turn dry, right? So as you apply the moisturizer over the skin, uh, nails also need good moisturization, right? So when we are taking care of hands, don't forget fingers between the digits, and nails also. And of course, filing of the rough edges is also very important. Active and passive exercise, when the patient is able to do, always ask him to do. Right? And when the patient is not able to do, at that time, we need to help. Right? It is very essential. These exercises have very good effects on the musculoskeletal system, cardiovascular system, right? In all the systems, it helps. If movement is very essential. So when the patient is in bed, we need to move him. So these are some of the advantages and effects of the exercise on different systems, right? So it will help in muscle tone, joint mobility. It will, of course, prevent deformities like foot drop when they are in the bed for long period of time. And we also need to see to it that we don't keep the top linen very tight around the feet, right? So to prevent foot drop, and other measures, of course, placing of footboard and like that. It will also maintain bone density and osteoporosis. It helps, right? Blood circulation, it helps in that. Right? Many advantages are there. It will also regulate body temperature, metabolic rate will be, and it will also remove flatulence, promote urinary functions, elimination of waste products. It will help in, it will also prevent deep vein thrombosis, and of course the formation and removal of the gas and the urine and stool. It will also help in good lung ventilation, right? Any collection of secretion in the lung can be removed with good movement and good chest physiotherapy. Right? It will help in good lung expansion. It will improve appetite and whatnot. Right? So when the patient is in the bed, it becomes our duty to make him exercise. These are some of the points. As I told you, we use always tell use normal saline for this and that. So we always have to teach them how to make it at home. Right? So either they can take 1 glass of warm water and add 1 pinch of salt, right, and nicely mix it. Or if you require large amount, then in 1 liter of water, add 1 to 2 teaspoons of salt, and then boil it for 20 to 30 minutes, and then store it in a good bottle. The sterile dressing, same way, how to make, right? So you can place it in either cooker or the vessel filled with water, okay, only 1 inch of depth you can fill it, and then place a mesh like structure, and over it you place the material. Right? Many times patient may need, because always they cannot go and buy the uh, gauze pieces. Okay, they are very costly. So at home, what we advise them is that cut any old clothes. They should be, of course, washed and thoroughly dried in the sun. Then cut into square pieces and then sterilize. Okay, so that is also good enough, especially if you want to use it for the wound dressing or like that, it can be used. And when patient there is any bleeding or like that, then always use dark color, because seeing the red color they will get frightened. Okay? And of course, not to forget how to dispose of the waste material. Right? In hospital it is very easy to dispose of, right? So but at home what to do, they should be taught. Then comes, because many of our patients will be having bowel problems also, bladder problems also, right? So many of them will have catheter inserted. So different catheters are used, like red rubber, polish catheter, silicone catheter, condom catheter. Yes, so all catheterization is generally a aseptic technique, right? So we should always remember that when we are doing polish catheter or silicone catheterization, that is totally aseptic technique. Okay, so that should be remembered. These are some of the types of catheterization, how the urine will be removed from which site. Okay, yeah, and depending on that, the catheter will also be used. So it can be indwelling catheter, right? Or it can be suprapubic catheterization, clean intermittent, self-catheterization. Okay, you need to teach patient how to do it, and condom catheterization. Okay, so by any of the means, you can remove the urine output. Okay, so what to remember? Patient should always take good amount of water, okay, unless it is there is restriction of water intake. Okay, whenever there is catheter in place, never to forget to have good perineal care. If patient is able to do, then can do with gentle soap and water. Okay? And good bladder habits always helps. So regular removal of urine. Okay, so that habit should be made maybe at 2 hours interval or 4 hours interval, right? As per the patient's habits, regular habits when the patient was in good health. Regular emptying of collection bag also, euro bag, that also needs to be emptied regularly. Otherwise, it will be a good culture media for the growth of the microorganisms, and patient can have additional problems. Changing of catheter also need to be seen. If it is Foley's catheter, then generally it is once in 3 to 4 weeks. If it is silicone catheter, it may be once in 3 months. Okay, but we also need to see that patient is not having any problems when patient is on catheter. Look for any infection, color of the urine, any leakage is there, right? Wearing of the gloves when we are catheterization or giving care, catheter care. Uh, Regular, it should not be kinked. Always keep the euro bag below the level, right? So that with gravity easily the urine will be collected. Okay, so this part should be taught to the patient's relative, because many times what happens that urobag you will find in between the legs. Okay, and the patients will complain of abdominal pain because the urine is not draining properly. Okay, many times the catheter gets kinked, and so there will be problem. There can be infection, right? So always see to it that it is always tight below the waist level, and urine is flowing freely. There is no bad odor also, no color change, everything. Self-catheterization technique also is taught to the patients. Many of the patients do this, right? So again, privacy is the concern, and you need to tell to the patient that they need to wash their hands thoroughly and then do it. Generally, nail cath is used of size 12 French. Okay, so after lubrication, the person self-introduces into the urethra and removes the urine. Okay, if necessary, they can use mirror also. Okay, and it should be done at regular intervals. Generally, patients prefer at the interval of 4 hours. Advantages are there because they have feeling of independence, and they get confidence also that okay, they are not dependent on others for their basic requirements. It is also easy to use and inexpensive. Of course, catheter care should be there. Okay, and they need to dry it. So how to do that, we need to uh, teach them, otherwise they can get infection. Condom catheterization, there are many advantages also and disadvantages also. On one hand, it is more comfortable compared to impelling catheter, and there is less restriction on the movement. It is non-invasive, so you need not ask doctor or nurse to do it. But on the other hand, there are chances of leakage if the size is not correct. Uh, and many people, they get irritation, skin irritation, because of the latex material that is used in condom. And sometimes when there is leakage, because of that also irritation can be there. And other internal more likely to fall off or leak than compared to internal catheters. So there are disadvantages also. So whenever the patient is on catheter, what to do and when to call doctor, these things should be told and taught to the relatives. If the patient is having bloated feeling in the abdomen, fullness, patient is having pain, right? If there is urine is coming red color, many times they get frightened, right? So presence of blood, cloudy appearance, right? Any particles are found, smell is coming bad, patient is getting fever, lot of itching and rash. Okay, so in such cases, always they need to check out with the health professionals. Perineal care is again very essential, especially when the patient is having catheter. So many times it gets neglected, right? So when we are giving bed bath at the end, also this perineal care is important. So at least cleaning with mild soap and water, right, daily 3 to 4 times, at least twice, not if possible 3 to 4 times. So this is essential. So again, when you are doing it in the hospital setting, one goes for one stroke. So that should be remembered. And if any bad smell or any other abnormality, any secretions, that should be noted. Many of our patients get constipated because they are always in the bed. So and find uncomfortable to go for passing motion when they are in bed. Okay, so find out what mode is comfortable for them. Uh, Most of the patients, they will ask that take me to the toilet. Okay, they will not be comfortable on chair or they will not be comfortable using bedpan. Diaper also, but when patients become bedbound, this creates a major problem. So constipation, you have to identify what are the causes. Okay, and in palliative care, we need to do anal examination, rectal examination, okay, and whether there is any ballooning rectum, then you may need to give high up enema. Then if there is a hard stool are felt, then there may be digital evacuation, okay, and then comes enema. Okay, because that will end up, patient can have many discomfort because of constipation, not only cramping pain, patient can have nausea, vomiting, patient will not like eating. Many times patient may vomit stool, okay, there may be excessive gas formation, and many other things. Patient may not be able to sleep also many a times. Okay, that is all will be seen in palliative care patients. Okay, so always find out what was his normal habit, and if you patient complains of constipation, then what to do, whether suppository is to be given or enema to be given. Okay, so that has to be uh, assessed properly. And this thing, of course, it will have good symptom control if you do this. Yeah, many times patient may require laxatives or stimulants. Yeah, so especially when the person is having opioids. These are the non-pharmacological measures. Right? Proper positioning is must, and give good time also, and privacy also. Right? Position and then gentle massage also will help on the back to relieve the pressure. Many times patient may tell you that patient is not eating, then how stool will come. Okay, but it is not true. Patient will have to, even in small quantity, but patient will pass stool. Okay, many times patient, even though patient is constipated, he will complain that he is having diarrhea. Okay, so that is known as overflowing diarrhea or spurious diarrhea. Okay, because the opening is closed because of the hard stool, so the loose stool which are formed above will pass from the side of the uh, intestinal wall, and there will be dribbling. Okay, so that is why good rectal examination should be done. Nasogastric feeding, regular feeding needs to be given. How much amount to be given? Then it should be generally 150 to 200 ml every 2 to 3 hourly is given. Unless patient is having terminal phase, not to force when patient is having in terminal phase, that should be remembered. And elevation of head is required during the feeding also, and for minimum 30 minutes after feeding. Okay, so that there is no backflow and patient should not feel fullness. Always check for any air that is trapped in the tube, okay, because then your feeding will not proceed. Aspiration is also there, right? If you aspirate more than 50 ml, you skip the feed, inform the doctor. What kind of food should be given, that will depend on patient's condition also, what he or she requires, whether high protein food or what, that needs to be checked. And of course, it should be home cooked ideally and strained thoroughly to avoid any blockage. So with that, I end my presentation. I hope that you have understood the basic points. Of course, many points are there which still require to be told, but I'm hopeful that I clarified most of the things.
Thank you,
Yes,
ma'am.
ma'am.
Thank you for the presentation, Anna, ma'am.
Thank you.
And we have a case presentation today. I'm welcoming Punithalakshmi ma'am for presenting her case. Punithalakshmi ma'am, can you hear me?
Yes, ma'am, I could.
I can share screen for you. I'll be sharing screen for you. Is it okay?
Yes, ma'am.
Okay, wait. Ma'am, can you see this?
Yes, ma'am, I can.
Is it okay?
Yes, ma'am, it is okay.
Okay, ma'am, then we can start.
Yeah, ma'am. Thank you, ma'am. And thank you, Anna, ma'am. The thing is, basic care is my presentation today, and everything you have completed, so I can give what we have given for our family member. Actually, this case presentation, I'm Mrs. Punithalakshmi, principal working in Jeet College of Nursing. And this case presentation is on basic care, which was given for my relatives who suffered with muscular dystrophy. So today I'm just presenting on that cases, ma'am. Next slide, please. Yeah, both the children, because the history is consanguineous marriage, first degree consanguineous marriage of the family, and we have four children were born in the same family, but the second and fourth were affected with muscular dystrophy, and both of them have passed away in the age of 18 and 21 respectively. The diagnosis is Duchenne muscular dystrophy, and right now they are not alive, so no. And history of illness, if we see, the elder one, both were fine till the age of 7 years, and then they started to lose the balance while standing and walking. The elder was first taken to the nearby clinic and later to the government hospital. And after the history and investigation, they ruled out muscular dystrophy was there, and they referred him to the physiotherapy center. And he was taken to the center, and since the distance was very long distance, the family was not able to continue with the physiotherapy. So they left with the physiotherapy and they kept the children, the elder one in the beginning at home. And later he started to have severe muscle wasting and couldn't move himself except his palms. Only his palms and his foot he could move. And apart from that, there were no movement. So the total palliative care was planned. But at that time, in the year of 1980s and all, palliative care was not very well developed in India. It was a basic care we were giving. And now when I started to study about palliative care, the first day what sir has told, Rajagopal sir was told, was the total care and from the time of diagnosis. So from the time of diagnosis, we did the care. So all the basic care we have given. I'm coming out of oncology because this is also a part of palliative, what I feel. Then when we have the younger one, since we know the happenings of the elder, we were a little bit alert to give more care for him and to extend his lifespan for 3 more years. What we did was with the basic care only, not anything else. Next slide, please. Examination is a history taking by the doctors. They have did it, and they did the elevated serum creatinase. The mother side, the maternal side has the problem in the forefathers, and the genetic problem, the gene, the faulty gene was there in the mother's blood. And the blood test and genetic test was done, and muscle biopsy was done, ECG and echoes were taken in the later stage, not in the early stage, in the later stage. Even they started developing the pigeon chest also because of this. The treatment and significant is we gave passive exercises because they couldn't move. So at home, the family was giving the passive exercises, and sometimes the physiotherapist used to come. And apart from that, the symptomatic treatment and the basic care was given to the children, both of them. And the medication is frequently, we didn't give anything. They were giving was for their respiratory illness only. They got it. Frequently, they'll get a cold only. Apart from that, they didn't suffer much problems because of their respiratory muscle spasm. They suffered a little bit. And vitamin supplements were prescribed by the doctors, and we were continuing it continuously. And protein diet, through diet only, we were giving the protein-rich food. That's it. And the psychosocial aspects as per, never left them alone. We all were there for a support of them, tried to give whatever they wanted, kept them happy by playing with them, because the elder was totally bedridden, like, because he was not well built. Yes, ma'am. Ma'am, can I continue?
Yes, you can continue.
Yes, ma'am. So the elder one, in the both the children, the elder one was very badly built. His body was, his physics was not at all built properly. The younger one was well built. Because of the care we know, from the beginning we started to give him. So they try to give whatever they want, the playing games without any age bar. Everybody started playing with them, because one will be lying down and one will be sitting in the corner with the support of pillows. And singing songs, which was their favorite, or we bought even a pet to play with them, and entertained with the watching movies and TV shows, and gave often gifts and chocolates for them to make them happy, to keep them happy now. And main concern at that time, as we know, the lifespan of our main concern was to keep them happy, that's it, and free from any other major issues till the end. So we concentrated on that.
Human link भेजती हूँ नया मैं free.
Next slide. And the summary is, both the children were diagnosed for Duchenne muscular dystrophy. Both children were given physiotherapy, vitamin supplements, and symptomatic treatment. Good nutritional food was given to them. Bed care was given more to the elder because of the poor muscle wasting, and he was unable to sit. Total care was planned and maintained at home only. The younger was able to sit and chat with people and move around with others with the help of the brothers and his friends in a wheelchair. The elder passed away at 18 due to respiratory muscle spasm, and the younger passed away at 21 due to cardiomyopathy and respiratory muscle spasm. And the points I wanted to discuss is, as ma'am have mentioned, we have given a proper back care, oral care, so they didn't get any oral problem. They didn't have any bed sore till they died. And catheterization was not done for them. We have given urinals for both, since both of them are males. We have given urinal for urination, and we have constructed a toilet which was comfortable for them to sit, and it is not dumped in the room. It was kept open only, and especially we have designed that for them to sit in, for their toileting facility. And on that basis, and we have given them the other cares like eye care, ear care was given continuously. We never left, because they can't move at all. So all the cares were given by the mother and the relatives only. Whenever we go, we support, and most of the time the mother was the one who was totally carrying him, and we were the supporters of supporting hands. So my discussion point is, in what way we would have improved the quality of life for both those children, and in what way we could have supported them more, and by whom it would have been better. And do you think the change in care can give a good prognosis and a prolonged life? Do you think the team has not done the follow-up in the appropriate way that we, and how can you plan for a total care in this condition? If it is in the future case, we are prone, happen to see such a cases in the future. So this is my discussion point of today.
Thank you, ma'am. And ma'am, Shiva ma'am is not with us. She is ill and she cannot join us. Could you please facilitate us with these questions? Can you deal with this?
Yes, sure.
Okay, thank you, ma'am.
I asked other participants also what they feel for this patient.
Okay, I will ask.
Madam has already told us that what they did. So what extra we can do? The other must be having some more idea like that. So let the participants also join.
Everyone, please put your answers in the chat box, or please unmute yourself and talk. Anna ma'am is expecting answers from your side. Everyone, please put your answers if you can. Please put on your video. Please unmute yourself and speak. Or put your answers in the chat box, please.
Yes, you can put your care in the chat box also. Any points? Okay. Feeling sad about children, right? And when children are involved, I mean, we always feel sorry for the family, because they, when the person is born, we expect them to live long, right? But many of the times it will not happen because of many reasons, right? So when birth is there, death is sure. So we have to accept, but when it occurs untimely, we always feel bad. But do you feel the care which was given to them? Because Madam has asked particularly whether any change in care would have given better support, and who should have given that care. See, I feel that what was done by the institute, that was very good. That even they tried and purchased a pet also, so that they have good not only passing time, but many times pet will also understand your feelings, and then you can cope up the stress very well. So that is the effect of having pet in your life. So that's good, very good part. Regarding all the hygienic care, all the kind of diet and everything which was given to them was very nice. So they could learn from the first case that, okay, how we can deal with the second case. So that was advantageous for the second one, right? And we can always have imagine the psychological trauma of the patient and the relatives, right? How they must have got devastated, right? So in palliative care, we have learned to do assessment, total assessment of a person and family, right? In palliative care, family is never left behind. Always think of the family also, because ultimately the family gives the care, right? Not only the healthcare team. So involvement of the care of a person is very important. Family involvement, friends involvement, right? So that is very nice. And the very essential component of palliative care is that we are not hastening the death, nor we are delaying it. Right? So whatever days the patient is having on this earth, we are facilitating them. Family is also facilitated, right? So our efforts should be in that direction, that we make their remaining days very comfortable. That is the main aim of this care, right? So because it is said by Cecily Saunders also, right, that the effect of or the memory of the death will always linger on in the family. So family of the patient will be there from the time of diagnosis and not till death, right? After death also family will be there. So family also need to be very effectively dealt with. And as this is a particular condition where the X gene is involved and mother is always a carrier, so we need to advise the main problem. And so genetic counseling is very essential uh, for the families where the internal marriages are done. So pros and cons of such thing always need to be addressed. So from our part, medicos, we can do that at least, so we can save future children. So that one point we can tell.
Yes.
Many other conditions are there which happen. So nowadays, at least thalassemia screening and all things are going on. So that is good that at least we are saving, preventing the birth of major thalassemia children. But then also the part of whole population will not be covered, right? There are many other conditions also we know as nurses. So wherever possible, we take part in such things is important, whether it is health education or doing things ourselves.
Thank you, ma'am. Thank you very much.
Thank you. It was very nice. After a long time, I also heard this about this condition. So very nice.
Thank you, ma'am.
Thank you, Anna ma'am, and thank you, Lakshmi ma'am. Is there anything to discuss again? Ma'am, can you hear me?
Yes, ma'am.
Is there anything to discuss?
No, ma'am. Thank you.
If it is over, I think we can end this session. And Anna Rao ma'am, thank you for your presentation. Thank you for facilitating with us, and thanks for this wonderful class. And I think we should have more classes with you. And to this FCPN team, this is our second last class, I think. And we will be having one more class with you. And kindly please provide your comments and feedbacks on the feedbacks. The link is already provided in